Good afternoon, colleagues. Welcome to the second session of our emergency webinars. As usual, we're going to allow a few minutes for attendees to join, and we will begin the webinar at 2:05.
Good afternoon, everybody. Thank you very much for joining our webinar session this afternoon. I just quickly want to sensitize all of the attendees. As you can imagine, there is quite a few activities that still needs to be completed. So I am going to have to ask your indulgence today. We likely will need to have a shorter briefing session or debriefing session in order for us to then also release some of the colleagues that is working with the development team and the development team to carry on with the activities so that we can stay on track. And some of the items that we have rolled into today that we can also then just work on a plan to recover those. And make sure that we at least complete them by Thursday and Friday. So if you'll permit me, I'm just quickly going to load the presentation and then we can start. Melanie, please just give me an indication once you can see that it's fully loaded on your side. I see it's...
Yes, it's taking some time. It's
Yeah.
now, here we go. It's
Okay,
here.
good stuff. Thanks,
Thanks.
Mel. Right. So I think, yeah, just a quick rundown of our agenda for today. So we just want to give an update on some of the main themes that we also picked up from the Q&A that we had for webinar 7th April. Also then just to provide a quick update on where we are tracking with company and user cleanup, the legacy data imports and processing, and then just reflect on some of the corrective actions, also themes that came through from the Q&A, as well as some additional requests that have come through from the support desk. Brief update for where we are with variations. That again, also a theme that's come through support desk as well as on the Q&A. And then we will just assess where we are, as indicated, if we have time for discussion today, or otherwise maybe just to look at some of the questions in the Q&A, just so that we can have a shorter session and let the team carry on with the work that they need to do. Sorry, I see actually that Mel, sorry,
Yes.
I have got the screen is now frozen on my side. Let me just, and I can't move the slides. I'm going to have to stop sharing and try and reshare. Oh, goodness.
You can send it to me as well if you need.
Okay. Let me try and do this again. All right. All right, Mel, let's see. Not sure why this thing is misbehaving, but let us try again. Okay, let me know once it's loaded.
Okay. It's on its
Drum
way.
roll. Yeah, there we go.
There
Can
we
you
go.
see it?
Yeah.
Okay. All right, good. I've got a thumbs up there as well. All right, it would be helpful if, there we go. Okay, so we want this one. So then just quickly, the feedback from a Q&A perspective. So some of the main themes that we picked up there is just the handling of our legacy submissions. So here specifically, I think the questions around certain sequences that were not visible. Once we've now re-imported, we saw that I think there was even this morning, there was just some confirmation that there may still be some legacy sequences that we do not yet have. So what we will need to do is share with you just a communication on Friday that then sets out the structure for submitting those sequences, as we will need to run a manual process for those to import them into DocuBridge and then bring that same information that's required for the data reference sheets in the portal across. So what we will do is just issue the communication. We will just outline that we need then the applicants that have still applications where we've got sequences that are not visible to provide to us a letter of intent to then submit those legacy sequences so that we can process them as a batch. Ideally, we would want to just then for you indicate by when you would be ready to submit those legacy sequences. So uploading then the ECTD submissions directly onto FTP and with the colleagues from Vector to then run a process to manually bring those in into the DocuBridge environment. Once they're in the DocuBridge environment, we can obviously then resync the main data column headers back to the portal so they will be visible in the application manager view. Where transfer of applicants have taken place and you are not seeing those, so this is now an approved TOA and you're expecting to see that application in your application manager view, but you're not seeing that, or where you are seeing something where an application was transferred to somebody else, please can you then send us those screenshots and that specific information to the portal support desk so that we can run a process with HPA to confirm the updates on the registration database in order for us to then also correct the reference listing within the portal. We will then revert back to you on a ticket by ticket basis for those. For the questions that was around post-importation testing applications, this specific work process is not covered in the phase 1 rollout for health product applications. Post-importation testing is still managed through submitting those applications on the FTP folder, and they will still be managed through the manual review processes by the inspectorate unit. So please do carry on with that work process as it was prior the portal go live. Right, just an update. I think some key issues that we wanted to flight. We'll talk about the action plan items shortly. What we are seeing is that the majority of our duplications on accounts on a request by request basis, we've been assisting those. We've managed to resolve most of those. If there are any additional issues, then please do continue to log your tickets to the portal support email address so that we also can then start doing the case management on an organization by organization level. I think, as we said, most of the issues from a bulk perspective has now been resolved, but there may still be some users that's experiencing challenges. That being said, with some of the updates and some of the corrections that was ongoing from Tuesday or after Tuesday 12 up through to this morning, with the users still being active on the system whilst we were synchronizing our stage environment with the production environment, we had I want to say a mismatch of user permissions where that desynchronized, and we then had reports of displays of incorrect application data sets across a number of affected users and organization accounts. Now, what we will unfortunately then need to do once a day, we will have to have a lockout of the production environment so that we can have no users active or open accounts whilst we are busy doing the synchronization of the stage to the production environment. This for us was a rather serious concern, and we unfortunately will now need to do a full systems lockout when that maintenance window runs. So I'll also just ask that from 4 o'clock today, we will then be taking the portal offline just for the maintenance. As said, unfortunately, we do have some organizations that were still busy this morning with account updates and changes. So we do have another run of data re-imports that we will have to complete. And we want to then just have a clean static environment from 4 o'clock onwards so that we can process those during the afternoon and the evening again. The other key item also just to reflect on is, by and large, we have been focusing and discussing quite a lot of topics that more has impact on the health products application processes for new renewal and variation submissions, and some of the matters and challenges related to that. And based on the conversation and questions that came through on Monday's webinar, there were some very specific themes for the Section 21 application processes that we need to engage with affected members on. So we have started those contact sessions, and there's more contact sessions that will be conducted tomorrow. And also a different feedback structure that will be put in place for that, just to ensure that we give adequate time and focus and attention to the different processes that is accommodated for on the portal at the moment. So even for today, I think our focus will be largely on providing feedback for the HPA processes. And as I said, we then have an expanded discussion with the Section 21 affected colleagues and stakeholders from tomorrow, and we'll continue to have those also running concurrent with then these sessions that we'll have again on Friday. Right, so I think maybe then just I can step through some changes that we've got. So I just want to, sorry, on my screen, this is now fairly small. Let me close that. So you'll note on the user account view, when you log in, there is a search function that's now been enabled and deployed to the production environment. This will then allow you to also search for your legacy applications. Of course, as you then go through this action, where basically you can now click on view the application, you will then be taken onto a next screen where you can now update all of that legacy data that might still be outstanding, that is then required for the trigger file to create correctly. So you'll see on this screen, we also then have further refined this. So all of the mandatory fields that are very critical for your trigger file to write with the correct information in order for the DocuBridge validator and automation to run and validate the submission. These are mandatory fields. So if you are filling something in one of the metadata fields and you move to a next one and that little block turns red, that means that's a mandatory field. You'll have to go back and populate that information. We do need all of that complete data to come across. Otherwise, our trigger files fail and we won't be able to have that application imported into the DocuBridge environment. So that enhancement's also been deployed. Then for APIs, so that question also came through on the webinar on Monday. We also had some inquiries for that on the portal support desk. So what you'll see is the enhancement that's been deployed into the production environment. First thing that will be asked is for you to do the search as the first step. It's really one of the things that we are trying to get right from SAHPRA's perspective at this point is to improve the data standardization and data quality. So the preference is always to do the lookup against 3 reference sheets. So there's the WhoDD, there's a drug bank, as well as then internal listings that we've got to find the API manufacturers, CEP, CPQ. So a lot of these reference lists, once you enter your search item and it starts to execute, it does take a little bit of time. So there is a few seconds that you will need to wait for the system to respond because it's running then and querying all of these databases through the web. If there is no results that's found, and I think this was the challenge then experienced last week and raised on Monday, how do we then move beyond that point so as to not to hold up your process to submit? The enhancement that's then been enabled is to continue with a manual entry. So please first search for it. Just give it a few seconds to respond. If there is no result found, it will return a no result found. And then carry on with clicking on the continue with manual entry. You'll then move through to another screen where basically this information would then be requested from you. So please then do help us to populate this information as accurately as possible because we would still need to do data cleansing and normalization of these manual entries. So if you already have information that you can just copy and paste into these fields, that'll be great. For something that's entity owned or doesn't have a CEP, CPQ, the option to just flag entity owned will be provided, and then there will not be a request to provide a number. If it's a CEP, CPQ, then that still needs to be linked to a reference number or one of the APIMF numbers that's on the SAHPRA database. Right. Further down on that application screen, as you'll recall, more towards the bottom half of the screen, we also have just introduced now this view so that you can see what is your application number, the submission that you are busy with, and then also the sequences that is available. So before you then save and proceed, do just confirm that the sequences are all correct in this view. If there is sequence numbering that is not correct, save your changes, but kindly log a query to us so that we can then attend to that. And likely it could be because of one of these legacy sequences that needs to then be resubmitted. So I think we will then communicate the process for that also in a more granular way with the issuing of the Friday communication. But this is being provided to also then just provide that view of what we have and what your sequence number will be before you actually proceed with creating that submission, proceeding to then the payment screen and so on. Right, so the update on some of the corrective actions. So a lot of the missing sequences should now have been resolved with the data import refresh. As I said, we do need to just see that as an ongoing activity as we still have some user account duplications and corrections that even this morning we were still assisting applicants just to correct. So we'll have that lockout window from 4 o'clock today, rerun imports again, and this will then be something that we will continue to work with you on. If there's something that we know should be there, as I said, please then do log those portal support queries so that we can action this on hopefully now a scale that is really just focused on those anomalies. And I think, yeah, the anticipation is with the amount of additional records that we've seen come in to the portal. We do anticipate bulk of those should now be available for the different applicants to view in their legacy data screens and then process them through into the application manager view. Right. One of the topics that we also spoke to on Monday, other than the enhancement on the API search, was that there are also other reference tables that is on the portal where we have had incorrect or out of date information displayed. I've shared on Monday that a lot of these data tables come from SAHPRA data tables, and we have pulled those records in as they were. What we need to then provide is the forms that need to be submitted for correcting the master data where there is an old entry or a missing entry, that we work with you to correct this. I think this is an opportunity for us to clean house. And all of that inputs that you would then provide in that way. It's a structured submission. We get the data, the specific data fields or column headers that we'll put on the form, which you will then populate, send through to us. We then have a dedicated person that is responsible for the master data maintenance. They then go and update the reference data record and then revert back to you on your ticket on the help desk so that you can then proceed with your application. So this will also be provided on Friday. We initially wanted to provide a form that gets filled in. However, we've had some discussions yesterday with the development team, and we're actually looking at enabling this on the portal itself so that it is online. And we try and avoid any sort of manual entry, finger errors. So literally as the information gets inputted by our applicants, that we can then process those also very much in a syncing between data tables and updating the information to keep it as accurate and correctly as possible. So typically the listings or the forms for reference tables that will be available then on Friday, they include additions or changes to the APIMF reference list, additions or changes to the SMF reference list, dosage form and route administration, as well as a online form for then variation table maintenance. So on variation table maintenance, we can talk to that shortly. That has been completed. We have rerun the checks with the internal colleagues, and that list we were hoping to publish by 12 o'clock today, but this will only be published then tomorrow. So with that being said, there may still be some enhancements that we would want to suggest or do on that variations reference table. So that also then will be made available through an online form. Very simple, few column headings that will then display with the ability then for you to add each row of data that needs to be corrected or added to then these different reference lists. Should we have any reference lists that we have not created a form for, we'd be happy to also receive those suggestions on the portal support desk so that we can enhance those lists and then make those lists available for master data maintenance requests online. So the first three, I think, main portal support themes we communicated on Monday is, as you log your query, either just in the subject to start with issue and then the description, and in the body of the email, the detail and information that needs to be shared. We will ask at this stage, some of the requests that have come through, it would be most helpful if you could also include then a screenshot if there's something specific that you are seeing, it doesn't seem correct, or you want to share that information. It helps us to resolve the tickets a lot faster. We've seen that the back and forth and reaching out to applicants and asking for more information or for screenshots, it just causes unnecessary delay. So I think if you can provide as detailed and comprehensive information as possible, that so this relates to then the issues, and then for master data, as I've said, we initially intended to publish a form, but we will actually now be looking at enabling this through an online form actually on the portal to just make this a little bit of a faster process. If there are still user account queries, we now have a reason code specifically for that, so that you can also then share those issues with us, and we can again just channel that for somebody that is focused then on user account maintenance and queries. And we've added this one of baseline for first ECTD submission. And this, as I said, to facilitate those email communications that we expect to receive from Friday onwards, for the expression of intent, where that legacy sequences will then be submitted, or a baseline submission needs to be submitted, in order for us to then assist the applicants to create an application ID, as well as then the relevant application numbers that relates to this legacy e-submission that now needs to be onboarded for the first time as an ECTD. It also will need to run through a managed and controlled process. Unfortunately, it seems that there is still quite a number of old e-submissions that will need to run through this ECTD baseline submission process. So we'll detail the process and the steps on that communication, and then specifically those requests will need to be directed to the portal support desks so that we can step through that process with you, get the application ID, build the different application numbers, and then release those so that you can actually do your submission via the portal then straight to DocuBridge once that master reference table has been updated. The specific activities that we shared for the week, items for 7th and 9th of April, as I said, love to turn that one green. However, we do note that there were some of the organizations that were still having a few challenges, and we've been helping and assisting those organizations just to get their accounts up to date. So this one we have as an ongoing process, and hopefully all of the user account challenges would then have been sorted out by Friday. We're really hopeful that everybody would have had a chance by then to complete their updates. So for the re-import of submission and sequence data, that was completed. The first run was completed then throughout the course of yesterday evening. And as I said, even this morning still we were running the re-import. Due to the issue that we then picked up this morning with that permissions being misassigned, we do need to then go into a very structured system maintenance window. So that then also applicable as of today. Legacy data, this will be also an ongoing activity that we will request that you continue to give your attention to. We have seen a lot of legacy data applications actually being processed and updated and moving through to the application manager view. So thank you for all of the applicants that have managed to complete those activities. Just acknowledging as well that for certain applicants, the list might be a little bit long and that might take a little bit more time. So we know that this is ongoing, and we hope also that that will be completed by tomorrow at 12 then, as originally indicated. For the 8th and the 9th, as I've mentioned, we wanted to share with you the variations coding table today at 12, but just due to that internal review and coordination, this will then be published Thursday morning only. The variations activity enabled then on Friday, that is still on track. And then the activity around our master data sheets. So the API enhancement that's been deployed, and then the activity and plan around creating the online forms for the rest of the master data reference tables set for Friday. Right. Still on track then to reopen for new applications tomorrow morning. Variations still on track to reopen on Friday morning. And as mentioned, for the old e-submissions, the process that is being deployed for taking in those baseline submissions in the new ECTD format as the first sequences, but then facilitating the process of creating an application ID and linking the application numbers to that, and then queuing that for you in your application screen, so you could then come in, do your submission for your baseline, and then to be facilitated through to DocuBridge. All those requests coming through to the SAHPRA support desk, when you've got your inquiry, kindly just give us the CIPC application type, submission type, strengths. So what were the application numbers? Which were the masters? Which were the duplicates? Just so that we have that detail and can populate the reference table accordingly. And of course, as soon as that is available in the portal, we will ask you then just to verify and confirm that everything is correct, and then process your baseline submission sequence. I suppose also again just left this reminder in for us to just continue to anchor ourselves around some of the activities that we know and acknowledge that will be ongoing. But yeah, I think some of the more prevalent matters is just that reminder around the proof of payments to ensure that they've got the correct order reference numbers and reflect the correct values. And I think that almost brings us to the end. So on the last slide, just a note, as we are deploying some of these additional enhancements and functionalities on the portal environment, we'll also be doing continuous updates to those training guides that's available. And that will be published also during that system maintenance window on a daily basis. And they will have a version control number so that you'll be able to see once a change has been effected and we've got a new version that is then published for that particular training guide. Right, and that is the last slide. I can maybe just check. I think Cornel has already had to step off just to work with the development team. So I'm not sure if there's anything else from the systems team side. Otherwise, what I would like to do is just for the next 20 minutes, just visit the Q&A section to see if there's any specific themes that we can talk to now. And then, as I've indicated, I would like to ask your indulgence just so that we can close this session today a little bit earlier, in order for us to carry on with the rest of the activities that is set for delivery Thursday and Friday. So if I can just go to the Q&A. Right, so okay, just I think running through what is the implication if legacy data is not done by tomorrow. So I think for us, we, as I've mentioned, we do note that some of the user accounts and account issues are still being resolved, and not everybody has had a chance to complete that, even post the first re-import, that we will still need to do probably another re-import, and therefore we've scheduled those system lockout windows so that we can just continue to do that. So everybody that then manages to finish their user account updates for that particular day at least from 4 o'clock onwards, we will then be able to re-import that data, and it should be then visible and available. If it's not visible and available, then by the next day, as indicated, there are still sequences that is not visible. Those we need to then have channeled through to the portal support desk, as it may be something where we have to follow a process of manually submitting these missing or legacy sequences. Okay, so I think, again, just a blanket statement on payment. The payment for the applications that's running through the portal, at a transactional level, it must match the order value and the payment reference number that's on the order forms. If payments have been made prior to the 1 April portal implementation, as I have indicated in the previous webinars, you are required to then submit a request to our finance department for a refund and process a new proof of payment with the correct amounts and reference numbers and re-upload that. Just a question on the Q&A document. So I have to, again, just ask for us to be given some grace on publishing a consolidated Q&A document. As you might imagine, we have been focusing and prioritizing the enhancements and some of the corrections and the support activities to help organizations just resolve some of the user setups and organization setups. So we should be able to work on a consolidated Q&A document over the weekend and provide that then by Monday. Right, I just want to see. I think just, yeah, I mean, any information API related, as I said, if there is still something that is not reflecting correctly, there is that manual override function that's available, so that we can at least just facilitate bringing that information on board if something is out of date or not available or incorrect. Right, so I think the save changes that I did show, that is available. Please confirm if the application ID number from RIMS must be added to the ECTD. Yeah, that must be added. Sorry, I'm just going through the questions. Once system refresh completes for legacy data, can we export all the lists in Excel file? This is required for ensuring accuracy of legacy applications with new application IDs. Whenever 3.1 will be updated to reflect this information, can you please update? Okay, so there's a suggestion just on a Pratipa, that's one for us, maybe then just to take, not portal related, but request just to do a update to the 3.1 guideline. In terms of exporting the list of the legacy data, well, I mean, all of the legacy data should now be updated and moved through to your application manager view. This is the export function for what is in your application manager view, meaning all of your applications. And so we have had that request also come through from the focus group during the testing session. That enhancement has been scheduled. Unfortunately, just with the corrections and some of the support activities that we've been busy with in the last week and a half, we haven't had a chance to start working on those enhancements, but I can confirm that that particular enhancement is on the list, and we will be providing then a reporting or a download tool to ensure that you can actually manage this and have the summary. I think originally this was requested, perhaps maybe not from a internal management perspective, but per application, to be able to do so, to provide that summary view also to new prospective applicants when there is a transfer of applicancy. So there was a request for a summary report. But I think, yeah, a full extract, we will note that and just do that reporting enhancement. Sorry, and then I'm just waiting for this to load. Right. Sorry. Mel, I am not sure the Q&A is not
Yes.
loading on my side. Let me just try again, close it and open it
Okay.
up again. Might be a bandwidth issue. I'm not sure if it's mine or my laptop's, but yeah, let's see. Okay, hopefully
Can
I
you tell
can.
me which
I
was the last question you answered?
I'm trying to scroll
Yeah.
down now, and just see it's just loading very, very slowly. Oh my gosh.
Mm.
Oh, there we go. Right, so okay, we've got, maybe if I can just ask this colleague, Anna-Marie Potma. You've indicated that you are still unable to log on to the portal or get access to the portal. Would you mind please just putting your organization's details into the chat for me now, so I can just ask the colleagues to have a look at your organization, and if the account verification emails were not clicked or linked, we can resend those just for the user account verifications to be completed, so you can also start your account correction activities. Okay. Submission numbers differ to those we included in trigger files. Please confirm if the new submission numbers included in the portal must be used and included in the ECTD. Submission number or application ID? Not sure, Anita, which number we're looking to include in the ECTD envelope. But as per the question asked and answered above, the application ID is what needs to be included in the envelope. Submission number is at a lower level. So we've got application ID, application number, submission number, and then sequence number. So I think I'll just refer to that structure in the 3.1. But if the question was, should the application ID be included, then yes, the answer is still yes. Right, there is a, when completing the legacy data, legacy data, what does the planned submission date refer to? So that would have been the original submission date that application was originally submitted to SAHPRA. So if that could be updated and populated so that we just have that thread coming from when it originally was submitted in then the same space. Right, so I think we've indicated dosage strength, etc., how we would be able to address those master data enhancements and corrections. So for the colleague that asked about adding a specific dosage strength, do then just use the online forms to do that master data request then as soon as they are available on Friday morning. Okay, and I've spoken about the INNs and the APIs. Charmaine, you've got a question on what does the status null and RCO-01 mean? May I ask, these seem to be specific application related questions. Would you be able to also do a screenshot for us just of what particular screen and what exact data field you're looking at? So we can just contextualize that and then assist and respond to your query. If that can be raised also as under issues to the portal support desk, we can then just revert back to you once we've had a look at those screenshots. Strength, how do I add a strength to a product? I do not have the tab to plus strength under masters. Again, it would be helpful to see the screenshot of what that looks like on your side. We've had a look this morning at the production screens and all of the fields after we did the release for the API manual overrides. They should all be there for all applicants to view. This is not something that's user permission driven. How do we delete legacy data not applicable to us? No, may you kindly send the ticket or the information to the SAHPRA portal support help desk so that we can just identify which of those linked to incorrect transfer of applicancy master data that came from the medicines registration database is really important for us to correct not only that on the medicine registration database, but as I said, because a lot of that feeds through to the portal reference tables, we just want to ensure that we fix both sources. So if you could pop that through on a mail to us, we can attend to those corrections. If you have completed legacy data and created a response sequence that is inaccurate, how would we go about editing that sequence? Dean, maybe you can just granulate. Is it the sequence number that needs to be edited, or is it information in the sequence submission itself? If you wouldn't mind just popping that also into the Q&A, and I can just follow on this conversation thread with you. Okay, question around not all possible indications are included in the lookup list. So indications, is that under ATC class? Is that under pharmacological classification? Pharmacological, yeah, classification indications. If you can just please confirm which of those two fields you're referring to, and also just pop that in the chat as well. If we completed missing data for legacy applications prior to the first webinar on Monday and the information is incorrect, which is now fixed, cannot be edited, should we log this as a ticket? Yes. Question from Rudy. Rudy, yes. If there is something that was corrected or changed, and we now post the re-imports, we've got those records locked. Please do log a ticket, as that will have to be done in the back end on the data tables by one of the dev support team members. Okay, only one API can be selected under ATC classification. Please advise how to proceed with an FDC tablet containing more than one API. So I think, Anita, yeah, that's an interesting question. I can definitely bring that back to the HPA team just to unpack how they wanted us to manage that mapping. As I've mentioned before on Monday, the ATC classification is to help us build a mapping structure over the SAHPRA pharmaceutical classifications. That's currently what the team are using as per regulation. So as we build some more data in the ATC and mapping that to pharmacological, we would want to transition. But this certainly would be an interesting one for us to unpack around fixed dose combinations. So I will revert back to the colleagues on this when we address it as well in the Q&A document. I have to say, I don't have an answer for you at this point. I'm not quite sure what the team's approach would want to be for this particular activity. As we then have that mapping one-to-one, how they see that working actually for a product that's a FTC. Again, questions, what does null symbolize? It would be helpful if we could just receive a screenshot for that, so we have context around what we're looking at. How do we reload a product that was accidentally deleted? I think you would need to, for those incidents, we would need to then just receive a support ticket. That is something that we will need to ask the development team to help us with, as those data tables sits in the back end. Even from a SAHPRA perspective, I mean, our system admin users, we don't have access to that at the moment. So we can definitely request support, but we would need all of the information that related to that record that was removed. Again, just a question for indications, no option for multiple indications. I'm assuming this also is for FTCs. I've explained also why the search is a bit slow, as it's checking 3 different lists, CEP, CPQ, and then the internal APIMF. So please do just bear in mind that it does need to run through all 3 those lists too, that actually searches and connects to websites. So it does take a few seconds. I know it's very frustrating in the current digital age when something doesn't respond within a second or 2. But this, as I said, the aim of this is to try and improve data quality and also minimize the amount of capturing errors or finger errors. So rather let the search run. Please do not use the manual override unless there really is no search result that is returned. And then there's a whole long list of questions, so I think I'll take the rest of them into the manual feedback document, just so I can try and cover maybe some of the other colleagues' questions. How long does it take to receive SAHPRA FTP server logon details once applied? Colton, so I think I'm not sure if you're a new applicant and you've submitted a request into SAHPRA's ICT help desk for this. Those colleagues also have been co-opted in assisting with the support desk tickets at the moment. So the typical turnaround for that would be, I think, 2 to 3 business days. If you can also just pop your organization's details into the chat for me, we can then try and find your particular support request and prioritize this for you if this is urgent. But as we are taking applications in from Thursday and Friday, we will endeavor to try and assist you with this before Thursday, Friday's reopening or activation of those work processes. Right, and I see there's a good few more questions. Right. Okay, colleagues, maybe what I can then do, as I said, I do have to ask that we just close off today's session a little bit earlier so that everybody that needs to just step into the development sessions can now be excused. So I think, please, Mel, if I may request from you and cause again just a full list of everything that was in the Q&A. as we are busy consolidating and have already consolidated no questions and feedback for Monday. But to add to this, and then obviously we'll do same on Friday so that we can publish the consolidated document on Monday. Great. Colleagues, thank you. And then we will have another update session on Friday. It's slightly earlier than the ones that we've been running Monday and Wednesday. And that just to accommodate some of the people that have indicated some constraints, time constraints on Friday afternoon. So we have got that one running, Mel, I think it was from 12 to 2, if I can recall.
Yes,
So
it's 12 to 2.
okay, so that at least will be a bit of a longer session, and we likely will be able to also then take some questions in that second hour, post the initial hour update. Thank you very much for your time, and also the support in resolving a lot of these challenges that we've been experiencing. Please keep the support desk tickets coming. Also, just bearing in mind, as I said, that we do, once an issue has been raised, do try and give us a reasonable amount of time to just work through that. Sending second and third requests, unfortunately, just bottlenecks the support desk system. We are systematically working through all those tickets. Each of those tickets gets transferred through to an issue log where they are group themed, and the main theme issues are prioritized for action. So as we conclude things, you will get feedback. But it does kind of, take a little bit of time doing the filtering if there's 2 or 3 requests and it's basically the same request that might have already been dealt with. So if we can please ask you guys, once the ticket has been logged, we have received it, it is in the work queue, and we will respond to you. And that's it. That's it for me from today. And we will see each other again on Friday. Thanks so much.